Hi, Barbies. Now I'd like to talk to you about the non-opioid medications. These are the meds that we give for mild to moderate pain. And the concerns depend on which med we're talking about. So let's talk about acetaminophen first. Acetaminophen is an antipyretic and also an anti-analgesic, a non-opioid analgesic. It's used for the indication is mild pain and fever. We have a maximum dose of 4 grams per day. And remember, if we exceed our therapeutic doses, we end up with toxic effects. So if you have acetaminophen overdose, we have an antidote, acetylcysteine. It's kind of easy to remember because A, and they're both really long. Acetaminophen and acetylcysteine. Remember, that's the one that we use for an antipyretic. If we want to work on inflammation, we use the NSAIDs. So ibuprofen would be one of the main ones, as well as aspirin. So aspirin is also an antiplatelet. So let's talk about aspirin next. Aspirin is an antiplatelet medication, and we are going to be monitoring patients on aspirin or on NSAIDs for GI upset and bleeding. In particular with aspirin, one of the things we're going to assess for is tinnitus. So if we get beyond our therapeutic range with aspirin, we can get what's called salicylate poisoning. And one of the signs of that, or aspirin toxicity, one of the signs of that is tinnitus. So we will monitor for tinnitus to look for aspirin toxicity. Another really key point with aspirin is it's contraindicated for anyone who already has a bleeding disorder, since there is a risk of bleeding. And then children, remember they are at risk for Reye's syndrome, REYE''S, Reye's syndrome, if we give them aspirin while they have a fever. So those are things we don't want to do. Other things to think about is we could administer these with food to prevent any GI upset. And these are, again, for mild to moderate pain. So if we assess our patients, they have mild to moderate pain, we're going to choose a non-opioid analgesic. If they have moderate to severe pain, we can progress to an opioid analgesic. I hope that helps. And that's your take on non-opioid analgesics.